All right, we're going to talk about permanent threads today because I know you guys are getting awfully confused. You see all the surgical drapes and all the sterility that's going on, and people get confused. Is it surgery? Is it not? It's a semi-permanent facelift. And we're going to break it down in 5 minutes. I wrote down all of your questions that you commonly ask us. Okay, so what is it? The permanent thread is a nylon thread. They've been using these threads since the 1940s, and they still use them today in operating rooms. So essentially, it's not going to dissolve. And that's why I like to call it semi-permanent, because the results are going to be semi. It'll last about 5 to 7 years, but the nylon thread will remain there for indefinitely. Can you still do fillers and Botox? Absolutely. So when you come in to do this procedure, we can combine it with a multimodal approach. We can combine it with fillers. We can combine it with PDO threads, which are dissolvable threads, and also Botox or neurotoxin. The numbing process. Now, this is done with local anesthesia, which means I don't have to sedate you. We'll probably offer you a Valium if you like, but you can be perfectly awake. I'm just going to anesthetize the area that the permanent thread is going to be placed subcutaneously. Difference between PDO threads and permanent. All right, PDO threads, they're dissolvable, basically a sugar molecule. Stands for polydioxazine. Their benefits outlast even the longevity or the lifting power of that thread. I'm talking about collagen production, hyaluronic acid production, which hyaluronic acid fillers don't do that. So it's good. Increased blood flow for up to a year. The nylon thread is not going to do that. Basically, all we're doing with that nylon thread is we're lifting everything up so you have a nice natural lift. So we can turn back the hands of time, about 5 to 10 years. Who are candidates? We're finding that everybody's a candidate. It doesn't matter as far as like age goes. You know, we have people in their mid-20s doing it, and now we're creating the filtered version of themselves. And then we have individuals who are in their 60s, and we're snatching them up too. We're even finding great, phenomenal results with people losing 100+ pounds. And that was something that was always a limitation. But we're seeing, but nevertheless, that's not to say that that goes for everyone. So I think doing a virtual consultation will allow us to get more or less a sense of an idea as to whether or not you're a good candidate. And if you're not, we're going to steer you in the right direction. We'll recommend somebody like a world-renowned plastic surgeon, Dr. Humberto Palladino, somebody that we work with closely. He's great. Difference between the non-surgical facelift and the surgical facelift. Surgical facelift obviously is permanent. You need to be rendered insensible to pain to the point where you require general anesthesia, which is a good thing. I'm not biased. I came from that world as an anesthetist. The semi-permanent facelift, which is using the nylons, that does not require any type of induced anesthesia where it's going to alter your consciousness. So in fact, with the semi-permanent, you can actually help us. We're going to hand you a mirror, and as I'm tightening that thread, you can see how much tension I'm applying. And I'll ask you, hey, is that okay? Can you live with that little puckering for a week? Sure, okay. And we'll tie it, and then we'll do it to the other side. Can't do that with a surgical facelift. So I think there's less chances of getting botched. Also, you don't have to worry about keloiding or having a nasty scar that some people endure. And some people don't want that downtime. Semi-permanent facelift, there's no downtime. You give it about a week, that swelling, that lidocaine that I injected gets absorbed, and you're back at doing whatever you were doing. Are the results immediately? Absolutely. So you'll see a lot of the before and afters that we're showcasing to you guys are immediately after. You even see their response when we show them the mirror. What happens after 5 years? Will my face drop, or do I have to do it again? You could do it again. Your face is not going to drop. Essentially what we did is we're slowing down the aging process. We're lifting up, but you're still going to continuously age. So unfortunately, but fortunately, it's only going to last for 5 years. What's the downtime to the recovery? I get asked, can I go to the gym? Can I get my hair pulled? Can I smoke? Can I drink? Well, you can smoke. I'd rather you not. You can drink. I'd rather you not. Gym, you can hold off for a week and you can resume all normal activity. As far as the hair pulling, try to keep it gentle. What are some of the side effects? There's not a lot of side effects. The side effects can actually come from getting an infection. Whenever you put anything into the body, there's always a chance for an infection. And that is why you see the sterile field and the sterility that's going on. That's why you see JoJo and I in blue drapes or sterile gowns. Is we don't want you to get an infection. Even though working on the face actually does help. There's a lot of good blood flow, so it decreases the chances of an infection. But nevertheless, we like to treat your face better than we treat ours. How long should someone stay after traveling here for the procedure? If you're getting just one thread, right, like the upper perma brow lift, you can stay here for 48 hours. If you're getting the neck, you stay here for 48 hours. But if you're combining the two, we want you here for 3 days. Because there's a chance that if you don't tolerate the pain, and we have to inject more lidocaine to make you comfortable, we don't want to get to that max dose and be limited. So we may break it up. We may do the upper, lower. Most of the time we're able to achieve it, but I like to have that sense of freedom to have that extra day so we don't feel pressure trying to push the envelope. Follow-up process. We're going to follow up with you immediately day 1. If you stay another day, day 2. If you stay the 3rd day, day 3, then 1 week, then 2 months. And what is the cost? Last but not least, the cost right now is $69.99. And if you got a promotional deal, kudos to you for following us. You probably had your notifications on. So if we take that $6.99, we compare it to a surgical facelift, on average, a surgical facelift is going to cost you anywhere from $20,000 to $25,000. Right? You have the semi-permanent facelift, that's $69.99, and then PDO threads. PDO threads, typically a mild package is $1,400. You're going to have to do that 3 to 4 times. Imagine if you do it 3 times a year, that's $4,200 times 5 years. You're looking at over $21,000. So this is a very cost-effective manner and to create a natural look that we've never experienced before. In fact, this is doing numerous things so that we continuously manage your aging process by injecting less within those 5 years. Because everything stays lifted, I don't have to use as much filler. So if you guys have any other questions on how we can gear the content towards your liking, just please drop a comment below. If you're interested, shoot us a DM. We look forward to serving you. My name is Jacob Sanchez. I'm a board-certified registered nurse anesthetist. Stay fresh.